What if I told you a 16-year-old's pancreas was so confused it didn't know what the hell it was doing? What if I told you this kid had both type 1 and type 2 diabetes at the same time, a medical combination so batshit crazy, it's like a car that's both out of gas and on fire? Today, we're diving into a case where a teenager's body is fighting a metabolic civil war, and the shocking discovery that this whole shitstorm was brewing before they were even legally allowed to drive, vote, or get a really bad tattoo. Welcome back to the channel where we explore medical mysteries with the maturity of a fraternity house during a toilet paper shortage. I'm your host, and today we're covering a case so rare it makes a unicorn look basic. This isn't your grandma's diabetes. This is a full-blown two-front metabolic clusterfuck that has doctors scratching their heads and reaching for a stronger coffee. Before we dive into this glorious mess, do the world a favor and subscribe and hit that bell. Because stories like this are the medical equivalent of a car crash you can't look away from, but with more science and hopefully less glass on the road. Let me tell you about Sarah. Not her real name because her medical chart is probably thicker than a phone book and more embarrassing than your internet search history. When Sarah was born 16 years ago, the first sign that something was up appeared on the delivery room scale. She weighed 4,200 grams. That's about 9.3 pounds of pure, unadulterated newborn. She was what doctors call macrosomic, which is the medical term for a baby that could probably bench press the other babies. Most babies are a manageable, cute little bundle. Sarah was a linebacker. Her birth weight put her in the top 10%, and while her parents were probably boasting about their big, healthy baby, the doctors were in the back nodding and thinking, well, shit, this is a red flag the size of a circus tent. Fetal macrosomia isn't just about winning the biggest baby contest at the county fair. It's often a warning sign written in 24-point font. Babies born this hefty have a significantly higher risk of developing obesity, metabolic problems, and diabetes later in life. It's like your body gets a memo at birth that says, all right, buckle up, fucko, it's gonna be a bumpy ride. Studies show these kids have up to a 30% higher risk of developing type 2 diabetes as adults. Sarah's story, however, was just the opening chapter of a medical soap opera. As she grew up, she followed the macrosomic baby playbook to the letter. She struggled with her weight, developing obesity during childhood. By age 12, she was significantly overweight, showing early signs of insulin resistance, which is the hallmark of type 2 diabetes. It's when your cells look at insulin and say, not today, buddy, we're closed. Then, at the ripe old age of 16, the wheels fully came off. Sarah started experiencing the classic symptoms of diabetes: excessive thirst, frequent urination, unexplained weight loss, and fatigue. But when doctors ran her blood tests, they discovered something that shouldn't have been possible, like a vegetarian tiger or a polite comment section. Sarah's blood work revealed a medical contradiction that left doctors more stunned than a man who just walked in on his grandma playing strip poker. Her blood sugar was dangerously high, confirming diabetes, but the autoantibody tests told a story that made no goddamn sense. She tested positive for multiple diabetes autoantibodies, GAD, IA2, ZNT8, all the classic markers of type 1 diabetes. This meant her immune system had gone full renegade and was actively hunting down and murking her insulin-producing beta cells, a classic autoimmune friendly fire incident. But here's where the plot gets thicker than a bowl of oatmeal. She also showed all the classic hallmarks of type 2 diabetes. She was obese, had severe insulin resistance, and her C-peptide levels showed she was still producing significant amounts of insulin. In classic type 1 diabetes, insulin production is usually completely nuked. In Sarah's case, her pancreas was still clocking in for work, but it was like a single minimum wage employee trying to run an entire factory while the rest of her body was actively setting the machinery on fire. This created a perfect metabolic shitstorm. Her immune system was doing a scorched earth policy on her insulin factories, while her body simultaneously had its doors bolted shut and refused to let the insulin in. It was like her immune system and her metabolism got into a brutal bar fight inside her body. and her pancreas was the pool table getting absolutely wrecked. The medical team was facing something they'd never seen before. A patient with the autoimmune destruction of type 1 diabetes having a knife fight with the insulin resistance of type 2 diabetes in the alley behind the pancreas. They called it double diabetes, and Sarah became one of the rarest, most complicated cases ever to ruin a doctor's lunch break. To understand why Sarah's case is so batshit, we need to break down how type 1 and type 2 diabetes are supposed to work. You know, like a normal fucking person. Type 1 diabetes is an autoimmune fuck-up that typically shows up in kids or young adults. The body's immune system, which is supposed to be protecting the fort, gets drunk and mistakes the pancreas for a piñata. It attacks the beta cells that produce insulin. Without insulin, blood sugar goes sky high, and patients require insulin injections to survive. It's a straight-up supply chain issue. Type 2 diabetes, on the other hand, is the one your doctor warns you about after your third consecutive "fuck it, it's Friday" cheeseburger binge. It typically develops in adulthood and is linked to obesity and lifestyle. In type 2, the pancreas is still producing insulin, but the body's cells have become entitled little shits and have developed insulin resistance. The insulin is knocking, but the cells have their headphones on and are ignoring it. These two types of diabetes were thought to be mutually exclusive, like a relaxing vacation and a colonoscopy. You couldn't have both because they involve completely different biological train wrecks. But Sarah's case proves that biology doesn't give a single shit about our textbooks. Her fetal macrosomia had set the stage for insulin resistance from day one, laying the foundation for type 2. Meanwhile, her genetics likely handed her a ticket for the autoimmune shit show that is type 1. The result was a double whammy of metabolic misfortune. Insulin resistance making it hard for her body to use insulin, combined with autoimmune destruction reducing her ability to produce it. Her pancreas was basically an employee of the month who was also being fired for gross incompetence. Treating Sarah became a medical nightmare of epic proportions because standard diabetes treatments are designed for one problem at a time, not this two-headed beast. For typical type 1 diabetes, the treatment is straightforward. Replace the missing insulin with injections. For type 2, you start with meds that improve insulin sensitivity and lifestyle changes, which is doctor speak for put down the donut and go for a walk, you lazy bastard. But Sarah needed both approaches at once, and they can work against each other like a married couple arguing over IKEA furniture. High insulin doses needed for her type 1 characteristics could actually worsen her insulin resistance. Medications for type 2 could interact with her autoimmune condition in ways that would make a pharmacist weep. Her medical team had to become pioneers, developing a treatment plan with the precision of a bomb disposal expert, with the creativity of a redneck engineer trying to fix a transmission with a coat hanger and a prayer. They started her on insulin therapy like a type 1 diabetic, but at doses calculated for someone with the insulin resistance of a brick wall. They added metformin, typically a type 2 drug, to try and politely ask her cells to stop being such assholes. They also had to monitor her more intensively than a helicopter parent because her blood sugar patterns were completely unpredictable. One minute she'd have a severe low blood sugar reaction, trembling and confused like a freshman after 3 beers. The next, her blood sugar would be stubbornly high, laughing at the insulin like a bad comedian ignoring hecklers. The psychological impact was a whole other barrel of monkeys. Sarah had to deal with not just having diabetes, but having a form of diabetes so confusing it made her doctors question their life choices and student loan debt. Sarah's case isn't just a medical freak show, it's revealing some uncomfortable truths about how we understand diabetes. First, it's showing us that the neat little boxes of type 1 and type 2 are about as useful as a screen door on a submarine. There's probably a whole spectrum of this shit, with patients falling everywhere in between. Second, Sarah's case highlights the mind-blowing concept of fetal programming. Her macrosomic birth wasn't just a random event. It was likely the result of her mother's metabolism during pregnancy, possibly from undiagnosed gestational diabetes. This early exposure to high glucose levels may have basically hardwired Sarah's metabolism for a future of metabolic drama. Thanks, Mom. Third, Her case is forcing doctors to put down the textbook and actually think. The standard approach of slapping a type 1 or type 2 label on a patient and sending them on their merry way might be completely missing the point for people who don't fit the mold. There are likely more patients like Sarah out there, misdiagnosed or getting shitty treatment because their condition is the medical equivalent of a platypus. It doesn't fit any known category. Some patients diagnosed with type 2 who respond poorly to treatment might actually have an autoimmune component. And some type 1 diabetics who pack on the pounds might need a hybrid approach. Recent research is revealing that Sarah's case might not be a 1 in a billion fluke. Scientists are discovering that the immune system and metabolism are in a complex, codependent relationship that would get them kicked off a reality TV show for being too dramatic. Studies have found that up to 10% of adults initially diagnosed with type 2 diabetes actually have autoantibodies, suggesting their immune system is also a little trigger-happy. These patients have LADA, or latent autoimmune diabetes in adults, which is basically diabetes with an identity crisis. Similarly, researchers are finding that more and more kids with type 1 diabetes are also developing obesity and insulin resistance, creating a hybrid condition that requires a choose-your-own-adventure treatment plan. The genetics are a tangled mess, too. Sarah probably inherited a genetic cocktail that predisposed her to both autoimmune fuckery and metabolic dysfunction. In the past, these combinations were rare, but thanks to our modern lifestyle of stress, shitty food, and environmental toxins, we might be creating the perfect storm for more of these metabolic mutts. Despite the absolute chaos of her condition, Sarah's case is providing valuable intel that could help a lot of other people stuck in metabolic no man's land. Researchers are now developing more sophisticated ways to classify diabetes based on multiple factors: genetics, autoantibodies, insulin production, sensitivity, basically creating a diabetic fingerprint instead of just two shitty categories. New medications are being developed that could be a godsend for patients like Sarah. These drugs target multiple pathways at once, like a special forces team tackling both the insulin deficiency and the insulin resistance simultaneously. Sarah's treatment team has also pioneered new monitoring techniques that could help other complex diabetes patients. They use continuous glucose monitors and fancy software to track her patterns in real time, adjusting treatments on the fly like a DJ mixing a track for a room full of drunks. Most importantly, Sarah's case is teaching doctors to look past the label and see the patient. Sometimes the human body is a beautiful, complex machine. Other times it's a gremlin you fed after midnight and you just have to deal with the mess. Sarah's story reminds us that medicine is still full of mysteries, and our understanding of diseases like diabetes is evolving faster than your dad's hairline. Her double diabetes may have started with her being a giant baby, but it's teaching us lessons that could help millions of other patients who do not fit the mold. The next time you hear about diabetes, remember it's not just one disease, but a whole family of fucked up conditions that can combine in ways that would make your head spin. Sarah's case proves that the human body doesn't always follow the rules, and that's exactly why we need to keep researching, keep questioning, and maybe keep a stiff drink handy for the doctors dealing with this stuff. If this deep dive into a pancreas's personal hell gave you a chuckle or taught you something, do us all a solid. Smash that like button like it owes you money. Leave a comment below telling us what other medical train wrecks you want us to cover, and for the love of all that is holy, subscribe. It's free, and it's the closest thing you'll get to a happy ending without having to leave a tip. Thanks for watching, you magnificent degenerates.